Hi,
Yeah, I can
welcome
see
back to
now.
Mindfulness, the channel where we attempt to open up a conversation surrounding mental health in India. Today we are joined by Ms. Seema Lalani, who has a diploma in counseling and in advanced counseling skills, that is cognitive behavioral therapy. She also has an MA in applied psychology. She has been working with depression and suicide prevention for people of all ages. Thank you for joining us today.
Thank you.
So the first question
Thank you
that
for
I have,
having me over.
thank you. So the first question that I have is, what exactly is cognitive behavioral therapy?
So cognitive behavior therapy, the basic premise is that our thoughts give rise to feelings, and the feelings give rise to behavior. And if we can change our thoughts, sometimes we have, and sometimes we have automatic negative thoughts, and if we can see which are our thoughts that are unhelpful, lot of them come from our childhood, lot of them come and they get triggered and we do not realize, so we kind of working on autopilot. And there are many thought distortions happen, like exaggeration and generalizing. We do not realize that. So say you have one small hiccup in life and one small bad marks in one test, so you go, you might be doing the thought jumping, maybe your distortion, where you start thinking up, nothing can work for me, I'll fail the main exam, boards, I will do badly in boards also, then I not get college admission, then this will happen. So you do this kind of cycle. So CBT helps you identify these thought distortions and then correct them, challenge them with more helpful thoughts and correct them. So CBT is also here and now therapy, where we do not go down to childhood, like what happened 20 years ago, and we don't try to correct that. We work with what we have now. I have these thought distortions. I identify my thoughts. I work on them. So essentially, it's a TFS cycle: thought, feeling, action cycle. So what thoughts happen to me? What feelings happen to me? And some of these repeated unhelpful thoughts happen. Once we identify them, it's easy to challenge them. So you could, like, you've done badly in a test and you identify that this is what I do, and then you will tell yourself, no, that's not true. One test, bad test doesn't mean all tests will be bad, because it's earlier happened to me. I've done badly in 10th, but I did very well in 11th. And, I've learned something and I'll move on. And it is, then sometimes tests don't work out the way you want them to, and the moment you challenge that thought, and these thoughts happen in split seconds. So identifying is a big part. Once you've identified and you find evidence for challenging them, and then you can move on. Then slowly that thing goes. The negative thought stops coming. You know.
Yeah, yeah.
So that's how this. You know.
Okay. So it's basically more
Yeah,
present focused than like focusing on everything that's happened in the past.
it is.
So it's more about like
Yes.
tackling the
So
here and now.
it is all about here and now.
Yeah.
Though these automatic negative thoughts have come from the past, but we see what exists now and how can we help you now. So it's not generally 3 to 6 months is the time frame for different issues once you've set your goals. So it doesn't take like Freudian therapy, which takes years because you delve into the past. So
Yeah.
this will also be quicker. You know.
Okay, yeah.
Yeah.
So you were
Yeah.
telling me earlier that you've done general counseling as well, and that you work with all sorts of aspects of it. So can you just give me a sort of comparative like benefit analysis between CBT and other methods?
Uh, so most important for me is CBT is here and now,
Yeah.
right? And it takes then shorter time. And I told you the belief it is based on that our thoughts lead to our feelings and they lead to our actions. And it can be corrected here and now. So now there are lots of ways and lots of different ways. Uh, this is the rationale behind CBT, which I practice and specialize in, right?
Yeah.
So it's just more here and now. It's very, very logical, where you choose evidence. and do it. It's very person centric, as in we help you see your thoughts, make a thought diary, and you challenge those thoughts. As a counselor, my job is a facilitator. So there will be no advice. So there is no advice. Not like you come up with your solutions. So that's the thing. And so I practice this mostly. I do know about Freudian other therapies, which are long standing. You delve into incident and this. So there is a lot of inference there. This incident led to this and all, which may be true, which may not be
Yeah.
true. So this is all very fact based.
Okay. Okay.
Yeah.
Got it. So
Yeah.
is there like a difference? I know that CBT works for people of all ages. So is there a
Yeah.
difference with the amount that like it's useful for like say children as compared to adults, or is it just like
No, no, it can be used for everyone. It can be so very young children maybe thought diaries are hard and all, and some specific problems like ADHA and all, they require specific things. So
yeah.
other than those, it works for everybody.
Okay, okay. Okay, so if CBT is more about the here and now, then I was wondering how does it help with issues like I know that you have specialized in depression and suicide prevention as well. So how does it help with those sort of things, which would be more long-standing, I suppose?
So, if you talk about mental disorders like depression and say schizophrenia, those things I worked with, there you first need medication. And what happens with depression is that because you've been depressed for a long time, you don't have a routine. So in CBT, we help you form a routine, help you get a structure, identify your depressing thoughts. But if, according to the criteria, if you can see you're clinically depressed, then I have to refer you to a psychiatrist, because medicine is not a part of CBT, right? But
Right.
what we can help you is once you recover 6 weeks of medication, to get back to a routine and to formulate structures which are more helpful for you, and that is how it can help. So suicide prevention and depression that I was involved with were NGOs who were just handling suicide prevention, and their CBT wasn't being used,
Okay.
right? So I started the befriender, where we were the helping people with suicidal ideation, and that's not CBT there, right?
Okay.
But once somebody is recovering from depression, that role sets in.
Okay, okay.
Mhm.
So, you said that it wasn't CBT, so can you just like walk me through the process of how that worked as well?
So, this was an NGO called Sumetri, and all the people are confident, all the work there is confidential, and callers call up, and there's a specific training. And this was how my counseling journey started. I started volunteering there. So, you have to volunteer 5 hours, and they train you according. So, where you mostly again do not advise and listen to people. Very often, people need somebody to listen to them and not advise, because
Yeah,
and just somebody to empathize with them. So essentially we worked with empathy. I'm there for you, I'm ready to hold your hand in this tough moment, and it worked miraculously. So that was a different training, and there's an entire training about it, so that all volunteers are same. And
yeah,
again, no advice, because it can vary from person to person.
yeah, of course. Yeah, yeah.
Yeah, yeah, yeah.
So, do you think that part of the reason that NGOs like this are so necessary in a country like India is because, like, for instance, like people's families would not be as open to discussing mental health?
In fact, the problem in India is reverse. Everybody is ready to discuss, and most people don't call up or go to therapists because they think कि India में तो joint family है, which replaces this whole system.
Yeah,
But the thing, it cannot replace, because those are not trained people, right? And sometimes it can cause more harm than good when they talk to their family. Reacts very negatively.
yeah,
कि क्या
yeah,
है, लड़का होके रोता रहता है, कौन ऐसे रोता है.
right.
Sometimes it might push them further,
Yeah,
right?
yeah,
So in fact we battle against this कि family से ही बात कर लो, बाहर क्यों जाना है.
yeah,
We
exactly.
it's a huge setback. So it's important in every country. I won't say a country like India. It's important in every country.
Yeah, of course.
And that because this training has to be very specific for a person who deals with a person with mental health issues.
Yeah, exactly. Like, for instance, I know that this is an example that I actually read a few days ago itself. If someone fractures their leg, they're not gonna go ask their parents to help them. But if
Yeah.
someone has like something wrong with their mental health, then they first go to their parents and they're told not to seek professional help. But like doctors have training,
Yes. So there's a huge
right?
So in India, there's a huge stigma around this where I will have my medication for thyroid, but I have to have for depression. I will resist it. I'll
Yeah,
not tell anybody. I'll hide and go. Right. So, and that's one of our battles to fight this stigma.
yeah,
You know,
yeah. So
Mhm.
another
And
question.
one has to realize a lot of it is chemical. Very often, mental disorders are all chemical imbalances, can be treated only with chemicals, and
Yeah,
there's no shame in it because all the other disorders we take tablets and it's all chemical, right?
exactly. Yeah. So
Yeah.
how do you think
Yeah.
that, we can push back against this thing of bahar nahi jana and just talk at home? How do you think that we can actually start like
um
acting that?
when you say we, who are you talking about?
We as in just like everyone, like the country, just India in general, right? Like people my age especially, because
If
I
you
have
want,
friends.
we want it would become easy. But what I think, and I have been planning to do this, we can have, outreach programs, and we can have awareness sessions where we talk about what is depression, when is it clinical, these symptoms mean this, and say, I'm not getting up in the morning and I'm crying all day, and my parents is in typical setup will start blaming me, क्यों नहीं उठती, try करो and करे,
Yeah,
that that uh, for the other people to understand the battle of the person going through. So awareness is the key. Once I know this is clinical depression, ये दवाई से ठीक हो सकता है, I will tell my child, I will take my child, I will understand it, because otherwise I just get, oh, I have a lazy child and it's shameful and it's all that. Once everybody knows कि ये depression का sign है, ये bipolar के sign है, it becomes easier. Then people, then there's no shame. Awareness, as you know, for everything, I think awareness is the key.
yeah,
So more outreach programs and awareness programs, more education regarding mental health, you know.
yeah, yeah. Okay. So I have one last
So like
question.
what you're doing right now, like what you're doing right now, right? This will help us fight against the stigma,
Yeah, yeah,
right? We are talking about it. First one
yeah,
is to start talking about mental health. It is real and it causes havoc, right?
yeah, definitely, yeah.
Yeah.
So I have one last question. Could you just maybe, like, as you said, we should increase awareness about, what the symptoms of different disorders are, so that, we can notice before we actually take, like, someone
Yes.
to a professional. So can you just point out some of those symptoms which might lead to, like, which might be necessary to go to a professional for?
So that's elaborate, very, very elaborate, because it's every disorder is well defined. And then there's like for depression, there are maybe 20 symptoms, and
Oh,
six of
wow.
these persist for 15 days or a month. And then you can clinically call it depression. Because, maybe you have a breakup with a friend and you can feel sad for a few days, and
Yeah,
that is not a clinical depression.
yeah,
And how we distinguish between normal sadness, or life may things happen, grief is different from depression, so there are all kinds of things, and this is very, very elaborate. But basically, if somebody loses interest or starts behaving very out of character, things that they enjoyed, they stop doing it or stop participating, these are mostly these symptoms and everything. But every disorder has very, very defined symptoms, and there are
yeah,
books written on that, so
yeah.
it's hard to tell, right? So, and it's if you go to that American Journal of this thing, it's psychotherapy. It's everything has been written about, and there are it's well cataloged. One can go through it and understand it.
Okay, yeah. So that's all the questions that I had for today. Thank you so much for joining us. And yeah, thank you.
Thanks, Ananya. Thank you. Thanks for having me over. Thank you.
Thank
Bye.
you. Thank you. Bye.
Bye.